is Dr. Karen DeVore.
Thank you, Dr. DeVore. I'll ask one last time. Can we ask questions along the way, or should we wait till the end?
You can ask whatever you'd like.
Okay, thank you so much.
I want to say good afternoon. I want to thank all of you all for the privilege of speaking up for medical freedom for both physicians and patients in this state. Y'all have heard a lot of information today, and y'all have been very attentive, and you've asked great questions. And I don't know that I have a whole lot more to say than what has been reiterated already, but I'm going to try to make this personal. My name is Karen DeVore. I have been practicing dermatology in Spartanburg, South Carolina for over 30 years. I have a high volume practice. I see about 50 patients a day. I have been prescribing hydroxychloroquine and ivermectin. They've been safe, they've been effective, they've been affordable, and I've been prescribing them for over 30 years. Every time I've written the drug for 30 years, it was off-label. I have not treated malaria in the state of South Carolina, nor river blindness in the state of South Carolina. So why? I mean, I had no pushback from pharmacies or insurance companies for 30 years. Everything I did was technically off-label. Why in 2020, all of a sudden, the FDA was calling ivermectin horse medicine? Physicians were not allowed to write the medicine? Pharmacists would not fill it for you? You know, where were the FDA, CDC, medical boards, pharmaceutical boards to be truth tellers in all this? Because I had a long experience writing these safe and affordable drugs, and I knew that there were trials that showed in SARS-CoV-1, that was the virus, you may remember a lot of Asians wearing masks in 2002, and I knew we had no FDA-approved early interventions. Patients were basically told, I mean, they weren't even seen by a lot of their primary care doctors. They were basically told to go home, and if you can't breathe and you turn blue, go to the emergency room, and then we'll give you remdesivir and maybe put you on a ventilator. And this was occurring while many doctors across the United States and other countries were having great results with repurposed drugs, hydroxychloroquine and ivermectin. I was noticing that my long-term patients on hydroxychloroquine for autoimmune diseases like lupus, they were not getting COVID in 2020. So why wouldn't you try writing these drugs? Why wouldn't you do vitamin D and zinc? What did you have to lose? And really, ironically, somebody already alluded to this, South Carolina is a right to try state. But because these drugs were already FDA approved for human use, even a terminally ill patient on a ventilator at the end of life was not allowed to try these drugs. How many lives could have been saved? And physicians have always had the ability to write off-label drugs. I mean, that just means writing an FDA-approved drug for a disease other than the FDA originally approved it for. Simple example, I'm a dermatologist. I could not treat cystic acne with tetracycline if I had to stay on FDA-approved labels. Could it be that these safe and effective and readily available drugs would have meant there would have been no emergency vaccine development, no coercion, no propaganda, no fear, no control, no cash cow for Big Pharma? I know you've heard today the PrEP Act and various other legal reasons that vaccine manufacturers are immune from any liability. Why would they spend time and money improving their product? I mean, that would hurt their bottom line. What other industry is exempt from liability if their product fails, proves dangerous, or is other than advertised? You've already heard the swine flu vaccine in 1976 was pulled after only 32 deaths. I don't mean only, those were deaths. But now we're over 1,000 times that many deaths. How many is it going to take? How many hospitalizations? How many disabilities before we recall these vaccines? So I began writing ivermectin for COVID-19 patients almost immediately. To my knowledge, not a single patient that I treated with ivermectin or hydroxychloroquine was hospitalized or died from COVID. Not only were there 0 side effects, patients amazed me. They called me back. They told me how overnight they felt normal again. Within 8 hours, their fever was broken, their rigors were gone. It was unbelievable. If I had not been witnessing such impressive clinical results, I don't think I would have continued to fight for my patients with the insurance companies and the pharmacies. Why would you deny this for anyone? But, patients couldn't get the meds I was writing. I was practicing medicine within the bounds of my medical license, and both I and my patients were being harassed. Pharmacists refused to fill prescriptions. And unknown to me until COVID, South Carolina has a law, Section 404386, that allows pharmacists to have the authority to refuse to fill any prescription for any reason at any time. I just want to repeat that. Pharmacists in South Carolina can refuse to fill any doctor's prescription for any reason at any time. Are pharmacists liable for withholding treatment? Pharmacists haven't been to medical school. They do not have the right to see and examine and treat patients with prescription drugs. I don't know how that's illegal. So supplies of ivermectin become limited. Prices are elevated. Patients used to get ivermectin for $20 before COVID. At the height of the pandemic, it was $300 or $400. And you know what that did? It drove patients to Tractor Supply. You know what? It did worked just as well. And then doctors and pharmacists started to be audited, including myself, from Blue Cross Blue Shield. Doctors were threatened with loss of their licenses and jobs. Our own South Carolina DHEC sent letters to physicians encouraging them to push the vaccine that was safe and effective, and really discounting ivermectin and hydroxychloroquine. And then we can get to the issue of privacy and HIPAA laws. How can employers ask your vaccine status? I can't ask about a person's medical conditions when I'm hiring or firing them. Pharmacists started interrogating patients if they thought the prescribed ivermectin was for COVID. I had seen and examined the patients. I had discussed the risk and benefits of the drugs for the patients. I had told them it was off-label. Pharmacists acted like that never happened. And isn't it a privacy issue for them to be questioning patients? Like, are you on valcyclovir for a cold sore, or is it your genital herpes? Is it doxycycline for acne or a sexually transmitted disease? And a pharmacist has the right to decline one of those and not the other? And insurance companies can pay for one of those and not the other? If that wasn't enough, doctors were harassed and vilified for writing FDA-approved drugs that I knew how to administer, I knew how to dose, I knew how to handle side effects, but I wasn't promoting the emergency use vaccines that had no long-term clinical data and that were given to pregnant women and children down to the age of 6 months of age. I can assure you no patient was forced to take an off-label drug that they considered dangerous or horse medicine. I cannot tell you people were not coerced and forced to take an emergency use vaccine. And I don't understand why, if you chose to take the vaccine and you put your own life jacket on, I don't understand why you cared so much that someone else chose to make a different decision. Your life jacket and your vaccine that works and is safe and effective should protect you, regardless of if your neighbor puts their life jacket on or not. Well, some patients trusted the government agencies. Let me tell you how that's turned out so far. In the last 2.5 years, since the vaccine has been widely promoted, and many patients have taken it out of fear and isolation, the patients who took the vaccine still get COVID. And now I see patients, and I could not believe the attorney who spoke this morning said he had heard the same thing, because in 30 years of practicing dermatology, I've never heard people describe their symptoms this way. I am itching from my bones out. I am on fire from the inside. I see the most unusual rashes, and they don't respond well to treatment, and they last for months or years. I see previously well-controlled autoimmune diseases like psoriasis and eczema and lupus now totally out of control. I see aggressive, severe shingles. It is more painful, it is lasting longer, and this is even in those who've had the shingles vaccine. I see rapidly growing skin cancers, including basal cells that are just supposed to be traditionally very slow growing. I see squamous cells, cutaneous squamous cells that are metastasizing much more often than they ever did before. And melanomas have become so unusual and much harder to diagnose. They are much more advanced at presentation. And I have to biopsy more and more things, and it's all in vaccinated patients. And then beyond my field, patients that I've seen regularly for 6 to 12 months, for every 6 to 12 months for 30 years, they're aging more rapidly. They've got unhealthy weight loss, their balance is bad, they're falling, they're black and blue, they can't get on an exam table. And you see their medical updates since they were in, and they've had atrial fibrillation, pacemakers, heart attacks, strokes, blood clots, DVDs, pulmonary embolism, Parkinsonism, ALS, tremors, nerve palsies, miscarriages, infertility. Did I mention aggressive, new onset cancers, recurrent, stage 4 cancers after 20 years of remission? I know 4 people in one small zip code in Spartanburg that have rare leukemias. 3 of the 4 of them are dead now. In over 30 years of medical practice, I've probably only known 1 or 2 people who had Lou Gehrig's or ALS disease, and they were distant and not really, third or fourth contacts. I now know 3 people in my immediate range of contact. I know a small middle school in the lower part of the state where 3 14-year-olds are struggling for their life with cancer. I went until I was in med school before I had a classmate that died of cancer. I've got 4 kids who went to medical school, who went through school and college and graduate school, and not a single one of them knew of a classmate that died of cancer. A week ago, I saw a 60-year-old man who was previously healthy, working full-time, got the 2 vaccines, 1 booster, 3 months later diagnosed with his first cancer, bladder, second cancer, prostate, third cancer, stage 4 lung. Am I to believe that's just coincidence? I can't turn a blind eye to this and pretend I don't see it. I can't ignore the elephant in the room these past few years. The vaccines have changed the whole medical landscape. People are suffering, and I think they're dying needlessly. The medical field, its boards, hospital protocols, pharmaceutical industry, CDC, FDA, DHEC, NIH, all have been publicly discredited. I don't know if we can regain public trust. I pray to God we can. I urge you today to stand up for medical freedom, for patients, for physicians. Please do not allow vaccine mandates that have little safety data while harassing patients who have other effective treatments. Remember, it is our Hippocratic oath to first do no harm. I thank you for your time and attention.
Thank you,
Thank
Dr.
you for all
DeVore.
you do.
Does anyone have any questions? Dr. DeVore. Thank you so much for your presentation, Dr. DeVore. We have, ladies and gentlemen, we have a House of Representative member, April Cromer. Would you come up here? You've been quietly sitting in the back all day long. And I would greatly appreciate if you joined us up here with your colleagues for the DHEC